Hi, my name is Alison Cabrera. I'm going to talk about acute kidney injury in patients with cancer. Definition: acute kidney injury (AKI) is a significant complication in patients with cancer and is associated with high morbidity and mortality. Rates of AKI vary in cancer patients on the basis of several factors, including type of malignancy, either solid tumor or hematologic.
That also includes subtle decrease in acute kidney injury, or AKI, when the kidney is not functioning at 100%. And that decrease in function usually develops relatively quickly, typically over the course of a few days. Actually, AKI used to be known as acute renal failure, or ARF, but AKI is a broader term that also includes subtle decreases in kidney function. AKI can essentially be split into three types. Pre-renal AKI, meaning the cause of kidney injury is coming before the kidneys. Post-renal AKI, meaning after the kidneys. Or intrarenal AKI, meaning within the kidneys. Watch the full video.
Applications in nursing. Monitor vital signs intake and output. Urine examined for color, specific gravity, glucose, protein, blood, and sediment. Assess patients' general appearance, including skin color, peripheral edema, neck pain, distension, and bruises.
Okay, so before we go on to the therapeutic modalities of getting those renals started again, I just have to let you know and remember that your pre-renal, another way to remember that is you have big buns, okay? Your BUN is big. So pre-renal, your buns are big, okay?
Pros and cons. Pros. The change in kidney function can necessitate adjustment in their oncologic care, such as chemotherapy options for diagnosis evaluation, and other supportive care. Cons. The outcomes of cancer patients with AKI are affected by several factors. Some cancer chemotherapeutic agents are cleared by the kidney. AKI alters the pharmacokinetic of these agents, which may lead to toxic levels.
Where we work, toxins and fluid levels are regulated, and that waste products and toxins are effectively removed from the blood. Acute kidney injury, or AKI, describes a rapid decline in kidney function over a period of days. AKI is usually diagnosed based on a rise in creatinine, a serum marker of kidney function, or a fall in urine output. What causes AKI? The most common cause of AKI is a reduction in the blood supply to the kidney. This can happen for multiple reasons, but it's most frequently seen in patients who are dehydrated or suffering from infections, especially if they are taking medication that can potentially reduce kidney blood flow.
Issue applied in Ecuador. The incidence of acute kidney injury, which is common in patients with cancer, depends on the type and the stage of cancer, the treatment regimen, and coexisting conditions.
This is Doug Brunk for Global Medical News Network, reporting from the annual meeting of the American Society of Nephrology in Denver. In what is believed to be the first study of its kind, researchers from MD Anderson Cancer Center evaluated the incidence, risk factors, and outcomes of acute kidney injury in cancer patients.
We know that acute kidney injury is on the rise, but little is known about its incidence or outcomes or risk factors in patients with cancer. So,
Conclusion. through evaluations to assess for general and cancer-related etiologies can assist in forming a treatment plan that best addresses the patient's kidney and oncologic issues.
There are two major types of acute kidney injury. There's blood flow mediated through things like shock and trauma, and then there's non-blood flow mediated through nephrotoxins such as cisplatin that directly target the tubules of the kidney. My lab's really focused on developing new therapeutics, really interested in looking at cell-based therapies. So at the moment, we've actually been targeting these endothelial cells that are critical for repair after acute kidney injury, and we believe